So we were discussing Graves' disease, clinical features of Graves' disease. Graves' disease will present as hyperthyroidism. It will have feature of hyperthyroidism. And in investigation, thyroid's TSH receptor stimulating antibodies will be present in 90% of the patient, and anti-thyroid peroxidase antibodies will also be present. Anti-thyroid peroxidase antibodies are present in both Hashimoto and Graves' disease. Now, what is the management of hyperthyroidism? The drug of choice for treating hyperthyroidism is carbimazole because it needed to be taken only once daily. There are two strategies. One is titration therapy and other is block and replace therapy. In titration therapy, carbimazole is started at a 40 milligram, and then its dose is gradually increased to maintain euthyroidism. And it is given for at least 12 to 18 months. This titration therapy has a fewer side effects than block and replace regime. What we do in block and replace regime? In block and replace regime, we block the thyroid synthesis with carbimazole, and then thyroxine is added to the treatment when the patient is euthyroid. And this treatment is usually done for 6 to 9 months because two drugs are used in block and replace therapy, carbimazole and thyroxine. So that's why it has more side effects. And the preferred therapy is titration therapy. Now, some side effect of carbimazole. Remember that women of childbearing mm, potential should use effective contraception during treatment with carbimazole because carbimazole is a highly teratogenic drug. It causes teratogenicity in embryos. So that's why women of childbearing potential treatment with carbimazole. Also, there is a side effect of carbimazole that it can cause acute pancreatitis. So if acute pancreatitis occur during treatment with carbimazole, it should immediately be and permanently be stopped because re-exposure to carbimazole may result in a life-threatening acute pancreatitis. And instead, carbimazole will use propyl thiouracil in such patients. Another side effect of carbimazole is agranulocytosis. It causes a decreased production of neutrophils. So granulocytes will be decreased. So in short, the side effect of carbimazole is they causes congenital malformation, they cause acute pancreatitis, and they cause agranulocytosis. So normally carbimazole is our drug of choice for the treatment of hyperthyroidism, but in some situation we'll prefer propyl thiouracil. Why carbimazole is our drug of choice? Because it needed to be taken once daily, and propyl thiouracil can cause hepatotoxicity. And propyl thiouracil needed to be taken 3 times daily. That's why our preferred drug for the treatment of hyperthyroidism is carbimazole. But in certain situations, carbimazole alternative is propyl thiouracil. And what are those situations? If someone experiences an adverse reaction to carbimazole, such as if someone develops acute pancreatitis, then in this situation we'll use propyl thiouracil. The women who are pregnant or who are trying to become pregnant within the following 6 months, or women with a history of pancreatitis will use propyl thiouracil instead of carbimazole. So pregnant women in the first trimester of pregnancy and in postpartum period, because carbimazole is secreted in the breast milk, so it is avoided in the postpartum period in lactating women. So in the first trimester of pregnancy, or a woman who want to get pregnant within the following 6 months, or she has a history of pancreatitis, will use propyl thiouracil instead of carbimazole. There is one other indication for propyl thiouracil, and that is thyroid storm. The drug of choice for the management of thyroid storm is propyl thiouracil, because propyl thiouracil decreases the synthesis of thyroid hormone, as well as it blocks the peripheral conversion of T4 to T3. That's why it's the drug of choice for the management of thyroid storm. So there are 4 situations in which we'll use propyl thiouracil and not carbimazole. What are those 4 situations? The first one is that a female who want to get pregnant in the following 6 months. The second scenario is that a female who is pregnant in her first trimester of pregnancy. The third scenario is that a lactating woman or a woman in her postpartum period. The fourth one is someone with a history of pancreatitis. And the fifth one is in case of thyroid storm, because the onset of action of propyl thiouracil is short, and also it blocks the peripheral conversion of T4 to T3. That's why it's the drug of choice for thyroid storm. So other treatment options that can be used in hyperthyroidism is radioactive iodine and thyroidectomy as well.